Hi guys, Don here. Welcome to Podiatry Practice Mastery, where we're helping you get your practice to the $1 million mark and beyond. I want to give a shout out here to Jim McDonald here from Podiatry Growth. He has been doing some consults, I think, with some podiatrists interested in getting help with their website. And during the course of these consults, he gets some really interesting questions. So he has kind of scrubbed off any identifiers of what practice he's helping and some of these commonalities of questions he's giving me, and then I can kind of help answer some of them, at least kind of what's been working for me. I can't say this is what'll work for everyone, but this is kind of what's worked for me. So I'm going to start with this first question from a doctor. So the question is, my schedule is full, but my revenue doesn't reflect how hard I'm working. Most of what walks through the door is nail care and routine visits. How do I shift my case mix towards higher margin care without losing the steady income from my existing patient base? So this is a challenging question. I think this is a question for young doctors that are maybe buying more of an established CNC visit, like a routine care visit. It also could be from someone that wants to develop a new practice or switch their practice around. So let me show a couple of ideas that might work. So my first one, and this took me a while to do, I wish I would have done this a lot earlier, is I developed a block time for routine care. So basically routine care, I only did 1 day a week. It was every Friday. And so that was the time where I had to see all the routine care for the whole week, which really kind of simplified my scheduling. Then after I got done for doing it a whole year, like about a year like that, I got a nail tech, and now I can get my routine down to only a half day. Now they are very busy half days, but I can put other kind of higher value patients in the other time. That would be my number one thing to do. And you might think, well, I'm going to have all this extra time. Well, don't worry about it. Or they're not going to come in only on Tuesdays. Well, don't worry about it. They are going to fit with your schedule. They're going to do what you want them to do. And if they don't, that's okay, because that'll help limit your schedule. Okay, that's number one. Number two is all other patients are being seen other days, and you can spend more time with these other patients, and then you can start incorporating new types of treatments for those. But even if you just got rid of all your routine care and put them on 1 day a week, and then saw all other patients the other days, if you had open time, you could take a half day and go market to other doctors. You can take this time to learn about new technology. But even if you get rid of the routine care, you could do much better with that. Now, if you have to keep the routine care, a couple of options. To make it more profitable, it would be doing like in-office durable medical equipment for like wound care type of things, like the collagen. That's something that works. Making sure you're doing ABIs in every single diabetic patient over the age of 50. Those are things that can really increase it. And then also doing a diabetic foot exam, or just a regular foot exam, looking at their overall health. They're going to have other things that you can do. An office visit once a year for all of those patients. So all of those patients you're doing routine care, you're also going to be able to do these other types of treatments. So those are my recommendations of how you can transition kind of more of a routine patient into more of a higher profitable payer mix.